state of California, our CalVets leadership that's assembled here, and Lisa and Stephanie, and the Secretary of Veterans Affairs, who just in a moment I'll introduce, that we're here on Memorial Day weekend, or the kickoff of Memorial Day weekend. It's an important, solemn weekend for families, for the opportunity for millions and millions of Americans to come together across their differences, take time to reflect and remember those that sacrificed their lives for the cause we hold dear, and that's our freedom. Never to be taken granted, never to be forgotten, and it is appropriate, despite this pandemic and all the strife, the challenges, all the consternation that it brings, that we take this time together with our family and our loved ones to reflect and to remember. I know for our family, like so many others of you that are watching, this is an important weekend. My grandfather, Arthur Menzies, spent close to 5 years as a prisoner of war. He was in Corregidor and Bataan, and he struggled and suffered not only to survive in the internment camps, but to come back into society, where ultimately, tragically, he took his own life. As so many those that were torn asunder in conflict and in wars, it's not just those that lose their lives on the battlefield, it's those that lose their lives coming back home that never left the battlefield. And so I want to just express my deep respect and admiration on Memorial Day, also to veterans and those that have come back from these more contemporary wars overseas, and also just extend our heartfelt thank you and deep respect and acknowledgement to the challenges, travails, and struggles that so many of our veterans continue to have as they come back from those horrific experiences in combat and other experiences, noble experiences related to their service at war. And so we're here in that spirit, in their spirit, in that light of optimism and respect for the opportunities they have all provided us. And I just want to make a point as we're here to make this point. We not only hold those things dear in rhetorical terms, but in terms of our practices. And I want to just recognize the outstanding practice of leadership that is demonstrable, not just here in Yountville, but in our 8 vet homes throughout the state of California. Over 2,000 veterans in these homes, protected disproportionately so because of the outstanding leadership of our Secretary of Veterans Affairs and his remarkable team, an outstanding frontline staff. That is not something every governor in the state of California, or rather across this country, not just in the state of California, can say. The reality is a lot of our veterans' homes have been disproportionately impacted by COVID-19 and the spread of this virus. A lot of our American heroes from World War II, not just the Korean War, Vietnam War, or Iraqi freedom, and other wars that are housed and supported in institutions like this have been immune from the spread of the virus. Quite the contrary. There have been some horrific headlines and tragic lives lost and examples where the insidiousness of this disease spread like wildfire through facilities like this across the country. That has not been the case, and I say this cautiously, soberly, not been the case to date in the state of California. Throughout our entire system, 8 hospitals, we have had just 3 patients test positive for COVID-19. We've had a number of staff, but the overwhelming majority of staff, all but 2, have recovered and are back at work. And that's because of the seriousness of purpose that was advanced weeks before California's stay-at-home order was put into place by our Secretary of Veterans Affairs. These facilities are not immune to the challenges that are so often present in the lives of Californians as it relates to wildfires, earthquakes, and other hazards. I think as a consequence, in many respects, of the emergency operation plans that facilities like this and others had already organized and practiced over the course of the last number of years, in particular with so many wildfires, particularly in this region, but also in Southern California. That has hardened people's senses and distilled a real focus and energy around protecting staff, protecting our patients and those we serve, the American heroes that are part of this system. As a consequence, Vito and his team were able to put together 38 specific prescriptive guidelines on infectious disease control, on temperature checks and symptom checks for patients as well as staff. Just coming in here today, you could see the seriousness of this. It's like the TSA times infinity in terms of the number of checkpoints and people that are asking you personal questions about where you've traveled and your current symptoms and your health, doing temperature checks, people wearing masks throughout this facility, and the seriousness of the sanitation that has been put into place. It's because of those protocols that we have been able to protect the most vulnerable Californians. These are folks that are getting therapeutic care, not just recreational support, but assisted living, skilled nursing facilities within these facilities, all levels of care that are being provided to our American heroes. And so I just couldn't be more proud and privileged to have Vito and his team here, but more importantly, to have the Secretary of Veterans Affairs here to my right to say a few words and I think to express, I hope, I imagine, as he does so often privately, perhaps a little more publicly, his appreciation to the frontline staff of these facilities that have gone above and beyond to protect some of our most vulnerable and heroic residents of this state and our nation. Vito?
Thank you, Governor. Good afternoon. Dr. Vito Imbasciani, Secretary of California Department of Veterans Affairs. I want to say, first of all, that I'm honored to have the trust of the governor of this great state in running these homes where we create an environment in our 8 homes from practically the Oregon border to the Mexican border where we try to create a home-like atmosphere where veterans can feel safe and we respect their military tradition and honor them by their congregate living experience. Before we came to this podium, the governor and I were further up the hill where this campus hosts a cemetery in which veterans of all of our wars are interred, going back to the Civil War and even earlier, the Spanish-American War. This is hallowed ground, and it's full of veterans who, as is the case with people who are in nursing homes across the country, are an extraordinarily vulnerable population. Not only by virtue of their august age, and we have veterans here in their 9th and 10th decades of life, going back to the early days of World War II, but by their underlying disease burdens and by the burdens that they incurred by putting on the nation's uniform, picking up a weapon and defending our nations in battlefields whose names you're all familiar with. So, ever since my earliest years, I was a victim of the polio epidemic in the early 1950s. And I was in medical school at the University of Vermont when the HIV virus that caused AIDS became epidemic itself. And because of those experiences, I always follow the CDC reports on the emergence of rare and exotic diseases wherever they are. And when I heard in December that a strange new disease, which was highly contagious and highly lethal, had emerged in Asia, I immediately convened our senior leadership. We have a robust emergency operation plan for this and all the other campuses. It was made necessary by the fact that earthquakes and wildfires happen all the time. In fact, a wildfire 3 years ago came very close to one of our buildings on this campus. We also have a plan to treat the epidemic that comes with flu every winter. So in early January, we started brushing off these things because I had a feeling that this could get out of control if the host nation, with the nation of origin, could not control it. And by late January, when we realized that the virus had escaped Asia and was here in California, we started a process that ultimately culminated in a progressive way in 38 steps, which we are happy to share with everyone, that gradually closed down the campus to the to prevent the entry of the virus, which I was afraid would run wildfire through the veteran population. And as the governor said, we did that, almost completely locking down the 8 homes about 2 weeks before the state of California went into a statewide stay-at-home closure order, thanks to the governor. We have a number of systems in place. For example, the veterans' homes have a physician in each home, and we have specially trained registered nurses who are expert in infection control. We teach every one of our employees, all 3,000 employees. It doesn't matter what your job is, whether you're a cook, a nurse's aide, or a groundskeeper, you know about infection control in our homes. So to make a long story short, we took all the guidance of the VA and the CDC and the organs of public health. There's nothing magical about what they wanted us to do. All their guidance is basically common sense plus a 10th grader's knowledge of germ theory, and we applied it to the veterans' homes. We just did it a month before everyone else and 2 weeks before the state. And I'm delighted that we have such success in protecting the wonderful men and women who are our connection to our past. I lost my own father this week. He was 98-year-old veteran of World War II, a Marine, fought in the Solomon Islands. We honor him as we do all veterans who died defending this nation. That's what Decoration Day and now Memorial Day is. But our connection to that history is by honoring the men and women that live in all of our veterans' homes. And my final salute is to the extraordinarily talented and dedicated staff that I have at all the homes, the leadership, the rank and file. To work at Calvet and to work taking care of these veterans is not just a job, it's a mission. And that probably explains why we have extraordinary attendance rates from all of our workers, even during the highest point of the pandemic. So thank you again, Governor, for your trust in me. I'm delighted to do this job. Thank you.
Thank you, Mr. Secretary, and Dr. Mr. Secretary. And I think that's an important point. There's simply not a state in the nation that has Secretary of Veterans Affairs that also happens to be a doctor. And I think fundamentally and foundationally, that has been determinative as well in keeping the infection rate down here. Not only, again, this facility built in 1884, same time, for what it's worth, the Washington Monument was built. It was that same year that a gentleman by the name of Mark Twain finished The Adventures of Huckleberry Finn. This facility went up, still maintaining itself as the largest in the United States of America. We've got 8 facilities in this state. Some are as small as just 60 or so. With capacity that can get to 900, roughly 1,000, roughly 750 people are being cared for currently at this facility. So again, I just want to thank the Secretary, his team, their outstanding leadership, the seriousness of purpose, as I suggest, that they have taken in terms of their mission. And I love that he frames this as a mission and a calling, not just a job and a vocation to help protect these American heroes.